Welcome, everyone. Today is day 4 of Research Speed Dating Week, and we've had a really great week of conversation and collaboration, and we're expecting the same today. Today, I'm Beth Dolph with the Office of the Vice President for Health Sciences, and today we are very fortunate to have with us the Dean of the School of Dental Medicine, who will be giving opening remarks. And then we will be following that with our 1 minute pitch round. And then we'll break into breakout rooms. Jill has them set up and she can go over the breakdown of those. So we'll have time for conversation in the breakout rooms, and then we'll come back together for a quick poll and talk about steps going forward with the connections we've made. And so I will kick it over to Jill for our introduction. Thank you.
Thank you, Dr. Dolph, and thank you for everything that you did to help organize these sessions. As Dr. Dolph said, they've been a lot of fun this week, and I think they're super productive. We've heard from many investigators that they're not only enjoying them, but we're actually following up with each of those groups to see how our office can facilitate moving the conversations forward. The intent of this is not to just get everybody together and then put the burden back on faculty. So we're going to be as supportive as we can in order to encourage the groups to continue to meet. So this particular talk is one that I was actually very excited about us finally bringing together, because one of the things that we attempt to do and are always looking to do is really find ways that all of our health sciences schools and topics intersect in oral health. I can't tell you how many presentations that I've sat in across all of the different schools, and it comes up, and we're very fortunate to have the expertise that we do on campus and the strength of the School of Dental Medicine. So Dina Rahu, for those of you that do not know him, he actually joined us a number of years ago, 2023, here at UB. And it was kind of exciting because he has a very diverse background and comes with a lot of different leadership experiences, including having been the chief scientific officer at the American Dental Association. He also served as the interim CEO of the American Dental Association Foundation. So he has a breadth of experiences that really complement the things that we're doing here at the university. It would be a misstep on my part if I didn't also recognize the talent and the generosity of his leadership team between Dr. Nascimento and Dr. Kirkwood, the ADRs within the school. They're always extremely great to work with, very talented, and just appreciate them actually taking the time to be here today too. So Dina Rahu, thanks for taking the time to do this. And we have no expectations. I mean, if you stay the full hour, great. But I know that a dean's schedule is a little chaotic. So thanks again for doing this.
Hey, thank you so much, Jill. Hello, everybody. My name is Marcelo Arujo, as Jill has introduced me, and me, Marceli, and Keith will talk a little bit about the dental school. I'm going to share a presentation before you go into your room. So bear with me. Let me just share this. As Jill said, I joined as the dean of the school. Continue to share. Can you all see? Yeah. Okay. In 2023, and some of you who are here at the beginning, I was here in AUB beforehand, and I think the training I got here in terms of interprofessional education was very, very important. You know, when even though I did my master's in oral science here in the dental school, I did my PhD in epidemiology at the School of Public Health, and then I did a fellowshipping period. That's when I collaborate with other people, including Dr. Derman here, doing something completely different. So interprofessional education and research has been always part of my career. So I'm just going to talk a little bit about the school, so you have an idea of the capabilities that we have, and then Drs. Nascimento and Kirkwood will talk a little bit specifically to the type of research that we have in terms of clinical and basic science, so you have an idea what the school has. But last year we completed a strategic plan for the school. As you can see, we are trying to figure out what the school will be in the future, really focus on research in education and clinical care. I don't know if everybody knows The dental school is the only unit in campus that has actually a physical clinic. We work as a dental clinic as if was in a hospital clinic. We're the only unit that has the capability. What that means is that we have patients coming through the school every day. We see patients as if they were going to dental offices anywhere, but also we see patients that come here because they do participate in our clinical research or because they donate some samples, saliva samples, plaque samples to some of our basic research. So we have the ability to work with the community to really bring not just the clinical training, but also the opportunity for the people to participate in research as patients or as subjects. And we are looking to really the future of the school to really be embedded in the commission and the community, as you see here in the mission. Okay, it's not moving. Okay, so you have to understand is the UB School of Dental Medicine is one of the two public schools in New York. We now are 6 schools, one more just opened in New York State, New York City. And but we are the only one in Western New York full dental school. Rochester has a training center, but mostly focused on advanced education. We do have advanced degree programs, which are the masters in oral science, orthodontics, and biomaterials, and one PhD in neurobiology. And I'll let Dr. Kirkwood talk a little bit more about this. And we have been going through a lot of changes since the last 5 years, I would say, with renovations, increasing in funding from research. And our department of neurobiology, we're very proud because it's for us the first one in this type, which is really the basic science. And for those who have been in South Campus or are in South Campus, they are located in the BRB building. Basically, when we look into our strengths, specifically in this area of research, we do a lot of work in digital dentistry. That's where dentistry is moving towards, which is a lot of things related to instruments that we use to collect information of our patients. We're implementing some of the stuff that is related to simulation and 3D printing. Our biomaterials masters has grown a lot since Dr. Sabrina Sohaki joined the school. We have a lot of students that chose that path and that path of research also. Implementing AI, as you know, we all are very aware of the importance of AI in the school. And also we do also a lot in our clinical training. And when we talk about how we train our students, is the interaction that we do through the medical school and through other schools with the SIM lab, with the OSCEs, where they do live patient simulations instead of treating. They pretend to be a patient and they work with the students. And then we look into how to train the students. I'm very proud to be one of the schools that really implement evidence-based dentistry into clinical practice, and that's how we teach, right? And our school has been known for the excellence in expertise. So the curriculum, the opportunity that we're looking the next years is really innovate the curriculum. There will be a curriculum change in our schools for the next 4 years. We just went through accreditation. Our pre-doc clinical, our pre-doc course went through with no recommendations. That means we are good to go for the next, but there's a lot of changes that have to happen, specifically in basic science, specifically in some areas of the clinic. We are looking to enhance clinical research, and we really make sure that our students have the opportunity to participate in research while they're still in dental school, hoping that they will stay in dental research afterwards. I'm not going to go through this goals specifically of the strategic plan. We can share this with you all later on, but you can see a little bit of what we're trying to do next. So with that, I think the next one is going to ask Dr. Here's the oral system. I think this is what you put, Keith, together. You're going to talk about this one?
Yes.
Okay.
So thank you, everyone, for attending this speed networking opportunity. I thought for most of us that were looking to potentially collaborate with faculty at the School of Dental Medicine, it wouldn't be lost on anyone if we kind of focused on oral systemic research that occurs here in the school. I think that may bring an opportunity that crosses all the health science disciplines. And so I wanted to focus on that. Certainly, there are other things that we do, and Marceli's going to cover clinical research. But in terms of the basic translational research that we do mainly out of oral biology, but there's other faculty even on this call who are also interested in doing this. I wanted to focus on oral systemic research. So what is this? So oral tissues and the oral microbiome are key drivers of systemic immunity and inflammation. So we can look at a lot of different things that occur in the oral cavity and then how this is disseminated to other systems across, not just the cardiovascular system, but also has, impact in cancer progression potentially, especially oral cancer and oral pharyngeal cancer. Neurobiome, immune biology is also something that we're highly interested in, and we're seeking faculty who can bridge these gaps with the neuro system. And also diagnostics potentially. We're actually, looking at opportunities for diagnostics that span this oral systemic realm, in part because we have, easy access to the oral cavity. So we can use the oral cavity as a mirror or a gateway towards looking at things that occur systemically. So you can see there that the research spans pretty much everything. I think we're regionally focused, right, in the head and neck area, but we're highly diverse within that system. So we can look at molecular, microbial, and translational oral systemic science. Also, what is coming down the pike in probably another year and a half is a new germ-free or gnotobiotic animal research facility. This was a large NIH-funded initiative, a construction grant, and this will be located on the South Campus in the BEB, the Biomedical Education Building, where the other animal facilities are. But this will allow us to evaluate causal and do causal-related studies related to the oral microbiome. And this is also, going to have a potential regional and national impactfulness. And then, my big pitch for everyone here is that we're really built for collaboration. As the dean indicated, his training has been interdisciplinary. I think, that speaks well for the ability for us, because we're a much smaller entity than some of those on campus. And so that allows us to be nimble and be also diverse in how we look at this. So we do collaborate already with people in public health, as the dean mentioned. I have a grant with the Dean for School of Public Health currently. Pharmacy, medicine, nursing, and engineering, we all have different domain expertise that we can cross different disciplines. So we are built for speed, we're built for nimbleness, and we're built for collaboration. Bottom line, we are a powerful gateway to look at systemic health. And I encourage folks to sort of look at this as an opportunity that we can bridge a bunch of different sciences together. So I'll stop there and let Marceli take over. She's the newer assistant dean for clinical research. And so, yep, there you go.
Thank you, Keith. Hi everyone, I'm Marceli Nascimento. As Marcelo mentioned,
Sorry.
as part of the strategic plan for our school to grow clinical research, we established during the fall of 2024 the DCRC, that stands for Dental Clinical Research Corps. We are a service-based corps that provides resource and expertise to support clinical research here at the School of Dental Medicine, but the DCRC is open to all UB faculty and students. You can pass, please. And you can keep passing. Good. The DCRC works pretty closely with all the other offices, research offices at UB, including Jill's office as well, to facilitate the processes of research of establishing clinical and translational research. The services that we provide support with, they go from comprehensive oral health assessments, radiographic imaging, medical assessments, and anything that relates to IRB submission and IRB consent. We also provide support with collection of biological samples, being saliva, dental plaque, blood samples. We also have space for short-term storage of samples being collected and processing the samples in our wet lab. And we've been engaged in clinical trials that goes from testing investigational devices, but we also able to test investigational drugs and clinical evaluation of any dental medical technology. As far as space, we are located inside the dental school in Squire Hall. We have 3 dental operatories. One of them has X-ray capabilities. Please. As I mentioned, we also have a wet lab for processing samples that are being collected and short-term storage of these samples, and a medical assessment room with a phlebotomy chair. For those who are interested in learning more about the DCRC and the services that we provide, you are welcome to browse our research, our webpage, and also contact me at any time. This is what I think we have one more slide if there's any questions. If there is any questions now or later,
Yeah.
Beth, I'm not sure what's next, but I can also pitch in later on, let everybody give their pitch on their research to talk a little bit more about my own research later. Thank you.
All right. Thank you. Did anyone have any questions? If not, we'll go into the 1-minute pitches. Okay, first on my list, Dr. Deal.
Can I show a single slide or?
Sure,
Okay.
go ahead.
Okay, today I'm just going to talk about ongoing work that I'm involved with a group of collaborators on what we call the oral health and disease ontology. The oral health and disease ontology was originally developed in part at the UB Dental School. Some of you may remember Alan Ruttenberg and a student, Bill Duncan. It's an ontology for representing dental medicine and oral health. And in recent years, I've been working with Bill Duncan, who's now at the University of Florida School of Dentistry, to continue developing the oral health and disease ontology. We have a grant-funded project that is developing ontology terms to represent dental care-related fear and anxiety. We work with psychologists and dentists and epidemiologists on that project. I've have an undergraduate student who's been converting the International Classification of Pain terminology into an ontology module to model oral facial pain. We've recently did some initial work on representing oral dysbiosis in the ontology, and also on representing different types of dental restoration materials. So we're interested in collaborators who are domain experts and also want to gain access to data sets for any of these domains that we could apply our ontology as a way of analyzing or reanalyzing the data.
Now, Alan, this is Keith Kirkwood just chiming in. I know it's just a 1-minute pitch, but for those who may not be familiar with ontology, can you explain that to some of these folks?
Yeah, sure. So an ontology, it's in part a terminology, but it's a terminology where the terms have logical relationships to each other and to terms in related areas. And in this way, we can create a computationally or a computable representation of a domain of knowledge. And when we annotate data with these terms, the data can be analyzed with help from the ontology hierarchy itself to gain new insights or inferences from the data. And of course, ontology has been very successful. The gene ontology, some of you may have heard of, is very widely used, and I've actually been very much involved in that over the years. I also work on something called the cell ontology to represent different cell types. And I have a lot of interest also with another group of collaborators in developing a overall representation for immunology and focusing on autoimmune disease. I'd be happy to talk to anyone, after this by email or Zoom to discuss what we can do more with ontology.
Dr. Cortez? Looks like you might be working on his audio.
Yeah, probably can hear me now.
Yes.
Wonderful. Thanks so much for having me today. Really a pleasure to be here. I come from a different background, actually. I did my medical school in Brazil, and I had been initially in Florida, now here. Thankfully, I was able to see this email last week and decided just to come in, and I've learned a lot of this first few minutes in the presentation, what you guys have been doing here. So my pitch today is about the association between intracranial aneurysms and microbiome in the, not only necessarily on the gut, but our oral microbiome. So we have some prior research, and you guys may be more aware than I am actually in the past. Association with some disease of the mouth and associated with vascular diseases. Initially was pitched by cardiology. There was some association between aortic heart aneurysms and also coronary plaque association, in which they were able to find some bacterial remnants and of macrophages and associated with local inflammation there that would be associated with the mouth. In 2013, I think we had the first study that demonstrated that some of this microbiome of the mouth could be located also on the aneurysm wall of patients with intracranial aneurysm undergoing surgery for clipping. There is sampling. After that, we had a few other authors that suggested this potential association between oral microbiome and not only the development of brain aneurysm, but also the increased likelihood of subarachnoid hemorrhage. None of these studies were conducted in the US. I think the initial study were conducted in Finland and had some in French and China. So especially hearing a little bit of what you guys have been doing, I think could be a good opportunity to see if there is any association that you can find there. The lab here, I work with Dr. Siddiq from neurosurgery. The lab here has been working with genetics for a long time, and I think that's something new. And of course, we would need the experts on dental to help us with that. So.
Great. Thank you so much. Dr. Nascimento, do you want to hop back on?
Yes.
Thank you.
So my own research program is related to the study of dental caries or cavities, and it goes from basic science, oral microbiology, molecular biology, all the way to the clinical management of this disease. So anyone interested in collaborating in this realm, I think Dr. Cortez just mentioned, I think there's a good opportunity here for collecting some samples and doing some analysis to look into correlations. That would be great.
Wonderful. Thank you.
I think that's everyone who I had signed up. Did I miss anybody, or does anyone else want to do a pitch?
I can do that. I'm sorry, I didn't know that I have to register for the pitch, but my name is
that's
Renato.
okay.
My name is Renato Casarin. I'm new here. I may be the newest faculty here. You'll be in this room. Next week, I'm completing my first year here in the United States. And I did my DDS program in Brazil, and now I'm starting my researchers here in United States, here at UB, with two main focus is the peri-implantitis, that's one, and the other is the early signs of auto and systemic disease in children using oral samples. So I'm bringing these research lines from my experience in Brazil, and now I'm trying to start some clinical trials here, populational studies, collect samples from children, families, and also here in the clinic in peri-implantitis sites to do microbiological analysis, immune markers analysis, and any other factors related to this disease.
Thank you for jumping on. And I see someone with their hand raised.
Yeah. Hi.
Go
Can
right
you hear me
ahead.
very well?
Yes.
Can you hear me? Yeah, this has been presented in the aging research as well because there is an overlap between the aging research as well as in the oral, research. So, can I share something?
Sure, go ahead.
Okay. Is it visible to everyone? Yeah.
Yes.
So good afternoon, everyone. My name is Satish Kumar Pulakar Shankaran. I'm a dentist by profession, and then I'm a dentist from India, and then immediately my dentistry, it happened to see a cancer patient. We have a huge cancer cohort actually in India, head and neck cancer patient, and they had a huge problem with mucositis. So I was so fascinated and so interested in studying more and caring for the patients. It changed my life actually if I can treat, all oral wounds, specifically oral mucositis, it changed the whole patient's, quality of life. So since then, I did my training, undergone my training in oral medicine, dental radiology, and then additional training from Cardiff UK in the cancer survivorship. And then lately, I had my training in Harvard Med School, especially on the clinical research on the Harvard Med School Brigham side. So this is the mucositis. This is the patient which I saw first. This is the patient. Last 20 years, we've been trying to solve this problem of the oral mucositis. These are the side effects or the adverse events of cancer treatment. Now, my goal was to treat it. So I tried my level best last 20 years to treat it. So whatever the available, still now, we don't have a treatment for this one. Only symptomatic treatments are there. And whatever the treatments are, the treatment modifications, the main cancer treatment modifications. So obviously, this is the head and neck cancer patient. They have the radiation, they have the chemotherapy. We have been trying to provide symptomatic treatment, but obviously these patients in the United States, they receive a heavy opioid. So what we did in the analysis was that to try see if the oral wounds are being treated, like let's say pain or any symptom, we found that these patients' hospital stay was less. Their mortality was less. And then that was like huge. We all know, but there was no data or there was like longer follow-up. Right now, I'm in the Department of Hematology Oncology, division and Department of Medicine. So I'm training medical students here. I'm training, residents, fellows, and everyone. But I'm still building relationship with the dental school to, how I can engage. I think I have been in touch with some of the person who are here. It's been 2 years I'm here in the UB. So next thing was to see if there any, in a larger meta-analysis platform, we tried to assess whether there was, if these patients have mucositis. We tried to, in a large meta-analysis platform, we found that if these patients have mucositis, they have a higher chance of infectious disease. Now, since I have training from, the MIT and Harvard, what we try to do here is like create an AI-based algorithm. This is a normal nomogram. This is not much any of use, but this is still indicates if these patients have a, mucositis, is there any factors, especially the demographics and clinical factors that can, predict these things. So we try to use through a machine learning approach. That's what I'm doing it here, especially collecting samples, trying to see if these patients can be predicted and trying to see if these patients' overall burden could be reduced or not. So that's all. And I also wanted to share one more thing. I created a group actually connecting different organizations. So the students can address the oral things and also learn more from the different. So can I share that too? We made a group called VBright. So we connect different organizations together.
Beth,
It's called V.
Beth, he's asking you if he can share some additional information.
Oh, sure. Go ahead.
Okay.
I didn't know if you were sharing another slide and waiting for it to come up.
So I also have a community work, which is actually, as we know that there is a high increase in the head and neck cancers in the region, especially the Buffalo. So we created a program called NICE program to see if there is any cancer screening can be done in local businesses and churches. That's one of the program which I run. Second thing is the VBright thing. I'm going to share that one. Right. Yeah. Yeah, this is the BeBright network. We are trying to, help, reach out to students who is interested in working with them. And we have organization from Roswell, Brigham, City of Hope, University of Adelaide, Netherlands. All of them are dental schools or med school students who are interested in um, the oral mucositis or the cancer adverse event. So Tufts is now joining, and also the University of Connecticut is joining us. And then we have published, it's been only 2 years that we have published some studies. Going forward, we also submitted some 27 to 30 studies, especially on the mucositis and adverse events information. That's what I'm trying to do from here, sitting in the Department of Medicine and Division of Hematology Oncology. Thank you.
Thank you for sharing. Is there anyone else before we go into our breakout rooms? It doesn't look like it. Okay. Jill?
So I'm the cruise director for Dr. Dolph. Basically, the breakout rooms, we have 3. You'll see them, they'll pop up on your screen in a minute. We have one dedicated to basic research, another to clinical research, and then a third for anybody that wants to have conversation about community engagement or programming. We'll let you go into the breakout rooms. We'll probably call you back 5 minutes prior to the close of the hour. There is a poll that we would like you to complete, and the primary purpose of that is to allow us to follow up and bring groups together after the fact so that the burden is not on you to connect afterward. I would say one of the things that we've talked about with other groups that we've met with this week, things to talk about would potentially be, what do you need to form a collaboration? Would that be an institute set up on campus, some seed funding to get a new project going that we could advocate for? Another opportunity would be to discuss any sort of RFP that you've seen recently, or that might be coming up, to actually start a conversation and get people talking. So with that said, I think those are great places to start. Your talks were amazing. I'll open the breakout rooms, and
Jill, can I say something before?
Oh yeah, sure. Yeah, Dana.
Hi. Oh, thank you so much for organizing this, you and Beth, and thank you everybody for coming up. And I think that Marceli and Keith will be able to answer more questions. We really want to increase this interprofessional research group that we have here. So thank you so much, Jill. Thank you, Beth, and have a great day. Good seeing you, Kurt.
Thank you for joining. Thank
Bye.
you. Before you go, I don't know if any of you know, if you're outside of the School of Dental Medicine, School of Dental Medicine is extremely highly ranked both nationally and internationally. So keep that in the back of your mind. We're talking about some really spectacular colleagues. So that said, the breakout rooms are open. And if anybody has any questions, Beth and I will be here in the background to jump into a room if we need to. I'm going to post a poll right now. And I think, first of all, I want to thank all of you for taking the time to be here. This was a labor of love for Dr. Dolph. We thought it was really cool when we came up and we discussed it in our strategic planning this past summer. And she had this idea, and we saw that it was successful at a bunch of other institutions. The whole intent behind it is not for us to get, and actually it would have been very, very complicated if we would have all of a sudden gotten 60 people on any of these sessions. The whole idea is that we're trying to support you as best we possibly can in forming new collaborations or bringing new opportunities to you. So with that said, if you can answer the poll, what we will do is I have a colleague who works in the dean's office who will help us to send out a rally poll and basically schedule some follow-up meetings and not bring everybody back together, but on the critical topics that you were all discussing over the course of this. So anybody want to chime in with any feedback before we wrap out? Because we definitely appreciate, Dr. Kirkwood, I saw you turned your mic off.
Yeah. Yeah, I just want to say thank you again, reiterate what the dean said, and thanking you for bringing everyone together. I think, like a lot of things, it's hard to do these things where everyone comes together. And then, Alex and I were chatting, so many things overlapping, but, there's people that are not here, right, that we can easily, and probably Marceli also thinks too, that we can kind of create matchmaking, right? Valentine's is Saturday, so now I'm feeling like Cupid and trying to, bring people together with all of these things. Is there, what's the best mechanism to do that? Because I just told Alex I would, email somebody and sort of virtually introduce him. Is there other opportunities that you can think of that would also foster interactions between people who we can think of that would interact with people on this Zoom today, but we're not here?
I think what we can do is we're going to take the preference of the groups first when we send out the rally poll and say, this is a follow-up. But when we do that and we get a date and time identified, we'll reach out to all of you and say, who else should this be extended to? To it, further the conversation and broaden the groups. And Dr. Kirkwood, to your point in a conversation that we had a few days ago, by all means, if groups come together and you do see that there is an opportunity and you need to, form and collaborate and get some ducks in a row, that's a great opportunity to come back to our office, and I can advocate to all the health science deans or Dr. Brashear and say, we need to get this team some seed funding in order to get things going. So we're not paying for the next 3 years of your grad students, that's for sure. But if you guys need a few dollars to get something going, we're very happy to try and make that happen.
Okay,
So.
that'd be great. Thanks, Jill.